Good afternoon, everyone. This is Ihoma, and I'm going to be talking about the use of alternative and complementary medicine. But before I start, I would like to say that this presentation or information presented is not intended to treat or diagnose. Please check with your primary care physician or primary care provider, nurse practitioner, or physician before taking any of this herbal medicine. And thank you for your interest in this presentation. We will enjoy our herbs and supplement. Just remember that we need to check with our doctor or our healthcare providers before we take any of this medicine with other prescription drugs or even this medicine with other condition that we may have. So the first one I'm going to be talking about is saw palmetto. A plant. This is a plant that produces a fruit. The ripe fruit is used to make medicine. Common names include sabal, American dwarf, palm tree, cabbage palm, fan palm, and scrub palm. So what does it do? So palmetto berries are used for prostate and other urological conditions. It shrinks the inner lining of the prostate that puts pressure on the tubes that carry urine so that the urine will flow like it's supposed to flow in men. Can we take it with other medicine? Supplemental decreases the production and effect of estrogen in the body, so it should not be taken while somebody is on estrogen or birth control for females. The supplemental also slows down blood clotting, so it should not be taken with certain medication that slows blood clotting as well. This may include medications such as aspirin, Advil, Motrin, naproxen, and others, heparin, warfarin, and coumadin. So possible negative effects. They're likely safe for most people, but my side effect might happen, such as dizziness, headache, nausea, diarrhea, constipation, and vomiting. So the next one I'm going to be talking about is garlic. Garlic is an herb used widely as flavor in cooking. It belongs to the onion genus family and is closely related to the onions. It originated from Central Asia and grows 2 feet high or more. The bulb of the garlic is used for medicine. See, the history had it that during World War II and World War One and Two, soldiers were given garlic to prevent gangrene, meaning foot ulcer, and they use it as an antiseptic. They put it on the wound to prevent infection or the wound getting infected. So what does it do? It is a very rich. It is very rich in antioxidant. It can help to fight off harmful particles or germs in our body, or free radicals that would destroy our cells and cause us to have other diseases. It can also help fight high cholesterol, blood clots, high blood pressure, bacteria, and certain cancers and allergies. It also helps to reduce enlarged prostate size, helps trick jerk, itch, and athletic foot. It can prevent atherosclerosis, hardening of the arteries, so that the blood will stop running smoothly like it should. So, but it helps to prevent it from happening. Garlic can decrease platelet function. Platelet function simply means that this is something called platelets. They will aggregate to form a clot and make blood not to flow like it should, form a blockage. So aspirin is usually used for this. You use aspirin to decrease this platelet. However, garlic can also do that as well. So that being said, taking aspirin with this might be very dangerous. It can also help with colon and stomach cancer prevention. It can help treat urinary tract infections. It also helps to prevent catarrh and colds. It kills parasites such as roundworms. Can we take it with other medicine? We shouldn't be taking it with any anti-clotting medicine like Coumadin, aspirin, warfarin, ibuprofen, Advil. Garlic can reduce the bioavailability of antiviral prostate inhibitor. So uh, it just simply means that it will stop it from functioning at its fullest when you take garlic with some of these antiviral. So garlic, possible negative effects, meaning the adverse effect, the effect that we don't want to see happen, like nausea, allergic reaction, including rash and hives, breath odor, low blood pressure, bleeding, contact dermatitis. Low blood pressure can also be a problem. So it will be blood pressure lower than like 60, the down systolic, which is the down one, and 90, which is the top one systolic. Garlic may cause reduction or decrease low blood glucose. It has been found in animal to actually do this, but then in human being that can also happen. So we just have to take these things with caution when we're giving it, or especially diabetic patients who are living with diabetes. I don't like to call them diabetics. I like to say they are living with diabetes. Should take this with caution. They must make sure that they check with their healthcare provider before taking this herbs and their diabetes medication together. So the next one is ginger, my favorite. Ginger, also known as zingiber, is native to Southeast Asia. It's also native to Africa and Australia. It is used for both medicinal and cooking purposes. It can be grown at home. If you keep it in a warm climate, it will grow. No wonder it grows well in Africa and Australia, Southeast Asia. Ginger is useful for many illnesses, most commonly nausea. It can provide relief from motion sickness, such as plain ride sickness, diarrhea, vomiting, and loss of appetite. Ginger can help us absorb the good nutrients from our food, promoting better health. It also helps with our menstrual cramp or muscle soreness, pain, and arthritis. Can we take it with the other medicine? Certainly we can. We cannot take it with certain medicine, but we can also take it with certain medication. But like I said initially, please check with your physician. Ginger should not be taken with any blood thinner, such as warfarin or aspirin, because ginger has blood thinning property as well. So that will double the effect of the medicine, and it can cause somebody to really bleed excessively. So possible negative effects during pregnancy, no more than 1,500 milligrams should be taken due to a high risk of miscarriage with high dose of ginger. Ginger root in its capsule form may be taken with food due to the risk of an upset stomach. How to make ginger tea? You can read that one really. Because of the sake of time, I won't go into it. So ginkgo biloba extract is derived from the dried leaves of the ginkgo biloba tree. It is native to Asia, but has also been grown in Europe since 1730 and the United States since 1784. So what does it do? It helps with memory loss, dementia, and Alzheimer's. Research suggests that it may protect nerve cells that are damaged in Alzheimer's disease and has a positive effect on memory and thinking. Intermediate claudication pain that's caused by reduced blood flow to the legs. It improves blood flow. It helps with the glaucoma, to improve glaucoma. One study found that people with glaucoma who took 120 milligrams of ginkgo daily for 8 weeks had improvement in their vision. Memory and thinking. Some studies show that it does help improve memory in healthy individuals as well as those with dementia, memory loss, and Alzheimer's. Can it be taken with other medicine? They could interact with blood thinner, aspirin, NSAID. NSAID is just like Advil, your naproxen, your Aleve. Antiplatelet drugs such as aspirin, anticonvulsant, seizure medicine, diabetes medicine should not be taken. Well, all this medication should not be taken with ginkgo biloba. So these are the side effects: headache, dizziness, heart palpitation, nausea, gas, and diarrhea. These are my references. Thank you very much for listening. God bless.